The spine is a very intricate anatomical structure composed of units that are interlocked and work as a unison. The disc is the shock absorber of the spine, and it lies between the two vertebral bodies. The nerves descend in the spinal canal behind the vertebral bodies and the discs. The back of the disc is in close proximity to the nerves. At each level, the nerves give rise to two smaller nerves called nerve roots because of their similarities to the roots of a tree. On each side, these nerves will converge and will give rise to the nerves that go down your leg, like the sciatic nerve. A normal disc is composed of two parts, a pulpy center called nucleus and a fibrous envelope called annulus. The nucleus provides shock absorbing properties and the annulus provides resistance. Small pain sensitive fibers are located in the outer third of the back of the disc. The sequence of events that generate a painful disc starts with the pulpy center, which loses water and becomes brittle. The disc starts producing inflammatory substances. These substances start eroding the inner aspect of the annulus, generating cracks called fissures. The pulp in the center of the disc can now push through these cracks and accumulate in the annulus. When the pulp accumulates, the annulus begins to bulge out and make contact with the nerve root. This is the so-called herniated disc. If the accumulation of pulp continues, the internal pressure of the disc increases until the annular fibers tear completely and this material pours out onto the nerve root. This is the so-called extruded herniated disc. The nuclear material and its chemicals irritate the nerve root, which becomes very inflamed. If the offending disc material is not removed, the surrounding tissues react, and in time, scar will form. The process then becomes chronic in nature.